Hey everyone, ready for another deep dive? Hernias. What exactly is a hernia and what causes them?
Imagine you have a weak spot in a tire wall. That's kind of what a hernia is like. It happens when an organ or fatty tissue pushes through a weakness in the muscle or connective tissue wall that's supposed to hold it in place.
Oh, it bulges out.
Exactly. And that bulge is often what people notice first.
Okay, so what causes those weak spots to develop in the first place?
Some hernias are congenital, meaning people are born with them because of a weakness in the abdominal wall. But they can also develop over time, often due to increased pressure in the abdomen. Things like straining during heavy lifting, chronic coughing, or even pregnancy can contribute.
So anything that puts stress on that abdominal wall. What are the most common types of hernias?
The most common type is an inguinal hernia, which occurs in the groin area. Femoral hernias also happen in the groin, but they're more common in women. We also see umbilical hernias around the belly button and incisional hernias, which develop at the site of a previous surgical incision.
So hernias can pop up in a few different places. How do we know if someone has a hernia? What should we be looking for?
Usually, the most obvious sign is a bulge, especially when standing, coughing, or straining. Some hernias cause pain or discomfort, but others can be painless.
So if we see a bulge, that's a red flag. What happens if a hernia is left untreated? Can it cause serious problems?
The biggest concern is what we call incarceration. This is when a portion of the intestine or other tissue gets stuck in the hernia sac and can't be pushed back in, and this can lead to strangulation, where the blood supply to that trapped tissue is cut off.
That sounds like a surgical emergency.
It is, so it's important to get hernias checked out.
Okay, how are hernias usually treated? Is surgery always necessary?
Surgery is the definitive treatment for most hernias. It's the only way to fix that weak spot in the abdominal wall. However, we might monitor small asymptomatic hernias in certain cases, especially in elderly patients or those who have other health issues that make surgery risky.
So it's a judgment call. What are the surgical options for hernia repair?
We can do open surgery where we make a larger incision to access and repair the hernia, but minimally invasive techniques like laparoscopic hernia repair are becoming more popular.
Laparoscopic surgery, that's where you use those tiny incisions and cameras, right?
Exactly. In laparoscopic hernia repair, we insert a laparoscope, which is a thin telescope with a camera, and our surgical instruments through small incisions in the abdomen. The surgeon sees everything on a monitor and repairs the hernia using mesh to strengthen that weak area.
So less invasive, faster recovery. Are there any downsides to the laparoscopic approach?
It generally has fewer complications and a faster recovery compared to open surgery. But it does require specialized equipment and expertise, and it's not suitable for all types of hernias.
Okay, so the choice between open and laparoscopic depends on the individual patient and the hernia. Now, we talked earlier about incarcerated hernias. Why are they so dangerous?
Remember, an incarcerated hernia is when the tissue gets trapped and can't be reduced, and that can quickly lead to strangulation where the blood supply is cut off.
Right, which can cause tissue death. What are the warning signs of an incarcerated hernia?
Sudden, severe pain at the hernia site is a major red flag, especially if it's accompanied by nausea, vomiting, or an inability to have a bowel movement. That's when you know it's time to act fast.
Okay, so those are signs we can't ignore. Thanks for joining us on this deep dive, everyone. Until next time.